Why to avoid going with implants that are too big for your frame? Let's talk about it. In breast surgery, there's a concept of looking too top-heavy, where the implants look a little bit too big for the patient's frame. Well, let's try and define that a little bit better. Most people might say it's when the chest looks too big and out of proportion with the rest of the patient's body. Even this definition may not be quite right, because for some patients, it may look like they have very large chests even though they don't have very large implants. Also, it doesn't help when we're comparing two different patients who have the same size implants and then look very different in their outcome. So I think the secret here is to focus on the frame that's around the breast. Specifically, we're going to talk about square frames and rectangular frames, or a short wide torso versus a long torso. For the breast, ideally the width of the breast is proportionate to the width of the chest, right? We don't want a breast that's too small and narrow, and we don't want one that's too wide. So there's kind of an ideal width for the breast. When we're talking about implants, we're really talking about circles, right? The width is relatively close to the height of the implant because it's a circle. So let me show you what I mean. So here we have two different frames. We have a long torso, it's a rectangular shape, and a shorter torso, which is more square. Here are our make-believe implants. And you can see when we put the implants that are the right width for the frame on a rectangle or tall torso, you can see that it looks relatively balanced and proportionate. If we take the same implants and put it on a square frame, all of a sudden now it looks too big. There's too much breast covering the torso. The area is not matching. Now if we add volume to these implants to get projection forward, it does not take a lot of volume to then look very much out of proportion to the shape. So for me, the tipping point for the breast looking too big and out of proportion for patients who have a square frame is a double D cup size. Once you're past that point, it's going to start looking disproportionately large given your frame. So for these patients, they have to balance the volume and the projection to avoid looking too top heavy. Hope this helps. If you have any other questions about plastic surgery, drop us a line and maybe we'll make a video out of that.